Hello guys, welcome to the Weight Loss Doctor YouTube channel. In this channel, we normally talk about lots of ideas on health, diet and exercise. In this particular video, we shall be talking about the 5 important tips that you need to follow if you are going over 30 years of age. This is a very important video and keep listening till the end. So here we start. Number 1, the first tip is regarding diet. You know, diet is the most important part, and what you need to do is change the concept of your balanced diet. What you should do, you should decrease the amount of carbs, increase the low GI carbs in your diet. Normally our Indian diets are loaded with lots of carbs, you know, almost 50 to 60%, and you need to decrease it to somewhere around 20 to 40 as per your activity criteria. So diminish the amount of carbs, keep the better quality carbs in, decrease the amount of processed carbs. Number 2 is, in the same tip, protein. There is a misconception that as we age we need to have lower amount of protein. That's not true. You need to increase your protein so as to counter your muscle loss, slowing down of metabolism. So that's second point. And third point in the same diet tip is your fats. Try to decrease the trans fat, those hydrogenated normal fats that have been solidified. Those are actually bad for your health. Increase the amount of omega-3 fatty acids. Those are very common from flaxseed, chia seeds, and even more important, deep sea fish oils. So take those omega-3 fatty acid capsules if you can take them from the market as supplements, and increase the amount of PUFA and MUFA. They are polyunsaturated fatty acids and monounsaturated fatty acids. Increase them on your diet. Try to decrease the saturated fat part and keep the overall fat at a balanced level. But the most important part is that to decrease your carbs and to keep protein to a maintenance kind of amount where you can maintain your muscles for life. So that's the most important first tip. And so the tip number 2, remember, you have to be active. If you had been a sedentary child or a youth during your younger ages, now is the time to be active. What you should do? You should move around. Try to just move around, have a walk for half an hour to 1 hour. If possible, you can do cycling. If possible, you can do home gym exercise like stretching or just moving around or doing the household chores. But remember, you have to move your muscles to keep active, and that's a very, very important part of this aging lifestyle and to cope up with that. So tip number 3 is strength training. We the Indians are extremely afraid of strength training because we think that whenever we are trying to stop it, we will get fatter again, and that's not true. Once you are in your 30s, you should continue the strength training for life, and that's the dictum. If it's not possible, try somehow to get into a gym. Do whole body weight training with compound exercises for at least 2 days a week, if not 3 days per week. And if you can't, try to use your body weights or use some elastic bands or other small materials like your dumbbells or a bench to use your body weight correctly. Get the help of a trainer. But strength training is extremely important for that part I talked about, the first point. That's keeping your muscles intact, not allowing to it go away, and if possible gain some muscles. But strength training or rather weight training is almost compulsory as you age, and as per myth it's just opposite. Forget that. Try to do strength training at least 2 to 3 times a week. Now stress is a very important problem. As you grow older, you have lots of stresses in your life. The financial stress, the marital stress, and the social stress, and there are lots, and it leads to prolonged high level of cortisol. Along with that, a disturbed sleep, and you won't believe several people have insomnia for long days of their life. All these lead to weight gain, increase water retention in your body. It increases the fat accumulation in the belly part, and that one of the very prime reasons for that belly fat gain of yours. So if you want to do something very early and very quick, it's removal of stress and having a better sleep. I know it's easier said than done, but at least keep it in your mind and give it a try. And the most important part that I should have told before being a medical professional, that is to have a medical checkup. You should have a regular, at least yearly checkup of triglyceride, cholesterol, HDL, LDL, all the lipid profile part, and that glucose, fasting and PP. Along with that, if possible, fasting insulin, vitamin D3, and for women LH, FSH and polycystic ovarian screening. These are very basic tests and will keep you aware of any metabolic problems or lifestyle disorders creeping in your life. So keep on guard, try to do this test, and if you find anything getting beyond limit, visit the doctor, tell him or her the whole problem and get it clear. That's very important. And if you don't follow that, the first 4 points won't fall into the place. So those were the 5 tips from the weight loss doctor. Don't forget to give a like if you really like this video and it has really helped you. And if you haven't subscribed to our channel, please subscribe and give a touch or a click on that bell icon so that whenever I release a video, it will get notified to you. So that's all for today. Stay fit, stay healthy. Meet you again next time.